Hello everyone, welcome to another TGIF episode of the Aunty Pharmacist podcast. Hope you've had a nice week so far. Well, for me, the week started on a very slow note, but I'm glad that it's picking up, okay? That Monday episode was a struggle for me, but I feel so much better now, really better, and I'm glad for it. So yesterday was World Diabetes Day, okay? It is a day that is set aside to recognize the disease called diabetes, its causes, its prevention, risk factors, treatment, and all of that. It is majorly to raise awareness, and each year a theme is picked, as a kind of topic to narrow it down. And this year, the theme for the World Diabetes Day is breaking barriers, bridging the gap, and that is what today's episode will be about. Okay, it is the World Diabetes Day special to actually intimate you with what it is about this year. Okay, so I'll be talking about what diabetes is and all of that, and majorly focusing on this year's theme, which I called breaking barriers, bridging the gap. So without further ado, let's get right into it. Firstly, a brief history of World Diabetes Day. It was first established in 1991 by the International Diabetes Federation and in conjunction with World Health Organization. It was as a response to the growing concerns around the diabetes epidemic. They noticed that a lot of people then were being diagnosed with diabetes, and they just wanted to create the awareness around it to reduce the number of people that come down with it every year. Okay, and that has been ongoing since then, and in 2006 it was officially recognized by the United Nations, and thus it was made a global observance. Okay, so every year on November 14, the world celebrates or marks World Diabetes Day. Okay, that is it about the history of it. And for this year's theme, which I called breaking barriers, bridging the gaps, it's about uniting to strengthen diabetes well-being. Okay, the goal of this year's event is to highlight the challenges that millions of people face around the world when it comes to the diabetes diagnosis. According to WHO, which is the World Health Organization, managing the condition requires resilience, organization, and responsibility, and it affects both physical and mental well-being, not only of the patient, of course, majorly of the patient, but even of people around them. It has both physical, mental, and economic implications. Okay, now what is diabetes? If you've been listening to this podcast for a while, you know that I always talk about diabetes. It is one of the commonest chronic disease conditions, okay? One of the commonest non-communicable diseases, and it is highly debilitating with a lot of complications if not well taken care of. So let me just do a quick rundown of the disease and what it entails before I go into the theme for this year's World Diabetes Day. So in plain terms, okay, diabetes is a chronic disease that occurs when the body doesn't produce enough insulin or cannot use insulin properly, which results in high blood sugar levels that are persistent. Okay, when I talk about insulin, it is an hormone in the body that helps to convert sugar into energy. It helps the body to utilize sugar. Okay, there are many processes involved in converting your sugar to energy. It converts glucose to glycogen, which is stored in the liver and which is utilized by the muscles when needed. That is the major work of insulin, converting glucose, which is the final product of sugar in the body, to glycogen. There is a particular organ that produces insulin. It is called the pancreas. Okay, and there are cells in this organ called the beta cells where this insulin is produced. Now, if there is a problem with the beta cells, maybe due to a congenital abnormality, due to genetic mutation or due to any abnormal condition such that enough insulin is not produced to convert sugar to that glycogen I talked about, then there's an issue. Without enough insulin, glucose cannot get into your cells and instead builds up in your blood. Now, when it exceeds certain values in the blood, it results to hyperglycemia, and when this continues without control, it results to diabetes. Okay, and if the insulin is even produced and the body cannot use it properly, you understand, then there is a problem as well. So this is what differentiates type 1 and type 2 diabetes. In type 1 diabetes, the pancreas produces little or no insulin, while type 2, the body becomes resistant to insulin or does not produce enough. Okay, that insulin resistance is the hallmark of type 2 diabetes, while abnormal insulin production or insufficient insulin production is for type 1. Type 1 usually starts during childhood or teen years, so it is usually called juvenile onset diabetes, while type 2 is more common in older people around 40 years and above, but can develop at any age too. Younger people can have it as well. Now, apart from type 1 and type 2, there are other diabetes conditions. Okay, I don't want to call them types in particular. There is pre-diabetes. It's a condition in which the blood sugar is high, but it's not high enough to be type 2. Okay, that is pre-diabetes. There are ranges of values in which your blood sugar level should be before you can classify them as either pre-diabetes or diabetes. Okay, I'll be talking about that shortly. Then there's gestational diabetes. It's a form of high blood sugar that affects pregnant women. You know, I told you insulin is an hormone, and during pregnancy, a lot of things happen to hormones in the body. The pituitary gland, which is the master gland responsible for regulating hormone secretion in the body, may be affected in some women. So there's abnormal level of some hormones more than others. There's abnormal production of some, and this could lead to gestational diabetes. For some people, it resolves after giving birth, while others are not so lucky. That could just be the beginning of their diabetes battle. Okay, because people are different from one another, right? Now, I said I will talk about the ranges of your blood sugar value so that you can know where you stand. Before I go into that, the device used to monitor your blood sugar level is called the glucometer. Okay, it's just a small digital device that uses a battery, and there are protocols to observe. You use a lancet to prick your finger. You use a strip to take the blood. You insert into the glucometer, and it reads your blood sugar level for you. It's usually presented as milligram per dl or millimole per liter. Okay, and it's something you can get. It is very portable. You can even put it in your pocket and nobody would notice. So it is advisable that if you are over 45 years of age, irrespective of maybe you have been diagnosed or not with diabetes, it is advisable that you have your glucometer in your house for convenience. But looking at financial situations, okay, we are not all equal. If you cannot afford it, because it's quite pricey, especially the strips that come with it, they are not cheap. Okay, you can always walk into your pharmacies and have your blood glucose checked at an affordable price. Okay, now normal blood glucose level depends on the type of test and when last you ate. Okay, there's something called fasting blood glucose and there's random blood glucose. This blood glucose level just aims to know the amount of sugar in your blood at a particular time. When we talk about fasting blood sugar, you shouldn't have eaten anything at least in the last 8 hours. Okay, that is why we ask you to come first thing in the morning to do it. You remember that you're supposed to sleep for at least 8 hours, right? So from dinner time, you should have like 2 hours before you go to bed. And by the time you've woken up, got into the pharmacy, 8 hours should have passed at least before you run your fasting blood glucose test. So we want to know the basal level of the glucose in your body. The normal is usually between 70 to 99 milligram per dl or 3.9 to 5.5 millimole per liter. That is normal for fasting blood glucose. While for random, it is either you have eaten or not, majorly maybe after you've eaten, irrespective of time. There is also an expected range of sugar that should be in your blood. The normal result is usually about 125 milligram per dl or 6.9 millimole per liter. It could be lower, okay? It depends on when last you ate. That is for fasting and random blood glucose. For other blood glucose tests, there's glycated hemoglobin and there's estimated average glucose in the blood. For glycated hemoglobin, it's usually in percentage, okay? It just measures the percentage of glucose molecules that are attached to hemoglobin in red blood cells. We are talking about the blood here. The range for glycated hemoglobin is less than 5.7%, okay? While the estimated average glucose is just like you are estimating the average glucose in your blood. The normal value is between 70 milligram per dl to 126 milligram per dl. If you notice that it is just like the range of the fasting to the random, okay? For non-diabetes patients, their fasting blood glucose level should not exceed 140 milligram per dl, okay? And your random should be less than 200 milligram per dl. When it exceeds, then their diabetes is not being controlled. Now, how do you know you have diabetes? What are the symptoms? There are 3 classical symptoms amongst other things, but those 3 are usually the pointers that a person might have diabetes. That is increased hunger, increased thirst, and increased urination, okay? You see that you are just urinating more frequently, you are becoming more hungry, more thirsty. Those are the 3 classical signs, okay? And sometimes it comes with unexplained weight loss, blurry vision, extreme fatigue, and sores that do not heal. And those last symptoms I mentioned, the blurry vision, sores that do not heal, they are usually as a result of prolonged diabetes that has gone undiagnosed. So it's already getting complicated at that point, which leads me to complication of diabetes. If left untreated or if you do not use your medications properly, it could lead to heart diseases, it could lead to nerve damage, eye issues, which could result to the blood vision I mentioned. It could lead to kidney damage. It could lead to amputation because your sores will not heal and the cells of that place will die, lead to gangrene, and the limb or whichever part of the body will have to be amputated, okay? Those are complications of diabetes, which we do not want. Treatment of diabetes. Number 1, before going to medications, lifestyle modifications. They are the first things that you must do to treat diabetes. You must maintain a healthy weight, eat a healthy balanced diet, exercise at least 150 minutes a week, that is 30 minutes per day probably, quit smoking, limit alcohol or just quit it totally, okay? And if it happens that you already have diabetes, work with your healthcare provider to treat your condition. Always go for your blood glucose check, use your medications religiously, and you might even live for years without any problem or complications if you observe all this. There are people that treat diabetes for decades and nobody would know because they are doing the right thing, okay? That is it about the disease. Now to the theme, which again is breaking barriers, bridging the gap. Why this theme for this year? According to WHO, there are some statistics that have come up in recent years, okay? More than half of people living with diabetes did not take medication for their diabetes in 2022. And diabetes treatment coverage was lowest in low and middle income countries. And diabetes causes blindness, kidney failure, heart attacks, stroke, lower limb amputation. In 2021 alone, diabetes and kidney disease due to diabetes caused over 2 million deaths. And around 11% of cardiovascular deaths were caused by high blood glucose. These statistics, they are overwhelming. It was noticed that diabetes is connected to a lot of diseases if not properly treated. To get access to the treatment requirements has become a problem, especially in low to middle income countries like countries in West Africa. I told you that the glucometer strip is expensive. You need diet and lifestyle modifications, which may not be affordable for some people because of the current economic situations. To even get hands on the anti-diabetic medications have become tricky because of hike in cost of medicines in recent years. And let me just bust your bubble. It's not only in low to middle income countries that all these challenges are taking place, it's just higher here. Even in the United States, people complain about not being able to afford their anti-diabetic medications without insurance. See, and these are medications you have to take all the time. You have to take every day. You can't afford to miss them. Insulin is a major treatment for diabetes, and it is used in almost all diabetes patients at a point in their treatment. And this thing is not cheap. So there has to be a way to actually make sure that people with diabetes have access to their medications. If care is not taken, a cycle results because of inability to get these medications. When you do not take your medication, then the complications result, which are debilitating. You will experience nerve damage, which will lead to arthritis. You experience blood vision, retinopathy, which could lead to blindness. You experience kidney diseases. It even makes it more difficult for you to control the diabetes. Okay, you could experience stroke. So even using your insulin yourself becomes a problem without the help of a caregiver. So it takes a toll not just on you as a patient, but also on the caregivers. So this is why this year's theme is looking at bridging the gap, okay, and breaking these barriers by uniting people together to fight this disease called diabetes. So I got this story from an health blog called Angle, okay, in which a diabetic patient in rural Nigeria shares his battle for survival. Okay, here's the story. For over 3 decades, Ahmad Abubakar, a 67-year-old trader from a small community in Potiskum, Yobe State, northeastern Nigeria, has lived with diabetes. I was diagnosed in 1990, he told Omango. And at the time, Ahmed worked as a laborer and initially attributed his persistent thirst to the nature of his work. He said, "I would drink water and then feel thirsty almost immediately." Ahmed also noticed frequent trips to the restroom, an early sign of his condition. Ahmed's life changed drastically following his diagnosis. He had to quit his job as a manual laborer because the demands were too much for his condition. I was told to stop eating certain foods, but then I would go home and find the usual meals prepared. I had no choice but to eat it, he explained. Over time, his body began to ache intensely, sometimes feeling as if he had been severely beaten. So here are the problems identified in the case of Ahmed. Number 1, he is a manual laborer, making him a low-income earner. So getting his anti-diabetic medications will be a problem. Number 2, if he does not work, he may not be able to get his medication, and this disease is debilitating enough that he had to quit his job. So he cannot earn money no matter how little anymore. Number 3, he has to make lifestyle modifications, which he couldn't do because the foods he was advised not to eat was the only thing available in his environment. He could not afford to get better. He could not afford the services of the nutritionists, so complicating his condition. Ahmed's journey with diabetes is a difficult one, as he rightly described it. At a point, his family had to compromise and cook his meals separately when his health began to deteriorate. "I stopped eating rice, bread, certain grains, and tea, amongst others," he said, noting that certain fruits like orange and pineapple were scrapped out of his diet, a change he was not happy with, but he had to accept for the sake of longevity. There are many people in Ahmed's shoes. They have to make certain changes to their lives that they cannot afford. These are the gaps and barriers we're talking about. So how can we as a community of people globally bridge these gaps. Number one, we have created the awareness about diabetes. Let us continue to create it, tell people about it. Prevention is always better and even cheaper than cure. So let us prevent diabetes by avoiding junk food, by exercising as much as we can, by being active, watching our diet, smoking cessation, reducing alcohol consumption, or quitting totally. These are things that would prevent the emergence of diabetes. Check your blood glucose level regularly. For somebody who has not been diagnosed, at least once a month is fine. But if you have been diagnosed and you're on medication, please endeavor to check at least once in 2 weeks. It is very, very important. So, who are the people that can help to break these barriers and bridge the gaps? They are the community, the caregivers, and the government. Okay? The community, you can help by spreading the news, by creating awareness about diabetes in your own little way. In your church, in your school, you can let people know that checking their blood glucose regularly is the best option for them. Go into any community pharmacy and get checked once a month or once in 2 weeks is not too much to prevent any occurrence that you would regret later. The government could help in that testing phase by making testing free in government hospitals. Create a particular day, maybe every month, where people can come in and check their blood glucose for free, especially for adults who are more at risk of diabetes, especially type 2. This can lead to early detection and prompt management of the disease. Another barrier is proper storage of medications. Insulin, especially, as expensive as it is, has to be stored at a particular temperature for you to maintain its efficacy. For it to maintain its potency, it has to be stored below 8 degrees Celsius. And with the epileptic power supply, it could just disintegrate when it's stored under normal condition. So the government has to help in this case by making sure that adequate electricity is available throughout the country, rural or urban. They should also invest in local pharmaceutical companies so that they can produce the drugs that we need locally, because these imported drugs, they are not cheap. The healthcare sector has to be heavily invested in by both the public and private sector in order to deliver adequate healthcare to people and to help fight majority of these non-communicable and communicable diseases. Then, in terms of diet, the community can help as a caregiver. When someone is diagnosed with diabetes, try as much as possible to align their meals to their health condition. Don't say because this is what we are eating tonight, we cannot cook your own food separate. Please support them. According to Ahmed, he has managed to follow his diet and medication thanks to his family and a consultant who occasionally visits his community to check on diabetic patients. However, this support is inconsistent. Sometimes it comes after 3 months and I go to him when he comes. That's what he said about the consultant. But at least thanks to that consultant who is doing what he can. I'm sure Ahmed is not his only patient, so it is understandable. If we have many people like that could do that, maybe 3 or 4, then Ahmed could get consistent care. But according to him, he had to rely on local healthcare providers in his community who lacked specialized knowledge during emergencies. So instead of going to local health providers, community pharmacists in that area could help Ahmed manage his condition. You see how we all can work together. I've talked about insurance on this platform. You could take advantage of insurance to have access to your medications. Each state, from what I know, should have an insurance scheme for their citizens. There's federal government insurance, there are private HMOs. Please get knowledge on these things, take advantage of them for your medications. At least they will take some financial burden off you. Like many other diabetic patient, Ahmed is uncertain about his future. He's living each day with the hope that his efforts are enough to manage his condition. The community, the government, the healthcare sector, the carers, the family can actually help Ahmed as well as other diabetes patients around us. Thanks to people, hospitals, community pharmacies, organizations, non-governmental organizations who organize free screenings during World Health Days like this World Diabetes Day. Please, individuals, governments should continue to provide free diabetes screening, especially for adults over 45, for early detection and prompt management. It is very important to be able to bridge the gap and to be able to break barriers when it comes to diabetes. Let us join hands to fight the disease. That is what this year's theme for World Diabetes Day is all about. Breaking the barriers to proper treatment and management of the disease and bridging the gaps in treatment. So, to recap what we can do, support them. We can even have a support group for diabetes patients. They would exercise together. There will be a dietitian or nutritionist that will draw a meal plan for them. There will be drive to provide them with these meals. Okay, the government should help strengthen the healthcare sector. Non-governmental organizations and well-meaning individuals could organize free screenings for these people. Adequate storage of their medications is very important, and the government could help in this. All of this will help to reduce drastically the number of deaths due to diabetes globally each year, which is way over 500 million. That is a lot of people. Apart from those that have been debilitated, that are rendered inactive because of it due to complications, like those that have become blind, those that already have arthritis, those that have come down with kidney diseases or stroke, those that have been amputated. So diabetes is not a joke. We have to all come together to fight it, okay? That way we'll break barrier and bridge gaps in diabetes treatment. And that is all I have for you today. It's quite a long episode, but I'm happy that I was able to do this to bring it to your attention, what you need to know about diabetes, the celebration of World Diabetes Day, and this year's theme. So in your own little way, whichever way you can, please continue to break the barriers and bridge the gap in diabetes management. Thank you so much for listening up to this point. I really appreciate your feedbacks that I've been getting recently. I'm really, really grateful for it. On all socials, I've been seeing them. Thank you so much. Please continue to support this podcast by liking, by subscribing, by sharing, by following, by commenting in the comment sections, and by engaging us on our social media platforms on Instagram, Aunty Pharmacist Podcast, on LinkedIn, Bemisola Adebisi Joseph, on Facebook, Bemisola Adebisi Joseph as well, on X, Fan Podcaster. As we launch into other social media channels, I'll be letting you know. Do not forget that you can reach me also via my mail for collaborations at antypharmacistpodcast@gmail.com. Okay, you could ask your questions, you could suggest topics and all of that. I'll be ready to listen and reply you. Once again, please, when I post, don't just like the post, click that link and listen. After you have listened, then if you have not subscribed, just subscribe. It is free. After you have subscribed, please comment on what you have heard, how it has impacted you, what you think can be improved, what you expected to hear, and all of that. Then share to somebody to also do the same. This way the podcast gets visibility and it continues to grow. It's for your benefit and for the benefit of everybody. Global health is every man's business. So please do it. Do the Lord's work. Thank you so much for listening up to this point. Till next time, stay healthy and God bless you.